Did you know that in the United States, the patient-to-doctor ratio is 300 to 1? This means that for each person in the U.S. to be seen by a medical doctor for primary care or other health concerns, they would be in competition with roughly 300 other patients to get an appointment. For patients to get the medical attention they need, adding mid-level providers such as nurse practitioners is pertinent to patient care. A nurse practitioner is an advanced practice registered nurse that has undergone further education and training to become a type of mid-level provider. Nurse practitioners work in almost any area of healthcare, from administration and policy making to primary care clinics and other specialty areas. NPs are trained to assess patients, order and interpret diagnostic imaging and laboratory tests, diagnose disease and illness, formulate and prescribe medications, and create treatment plans to fit patient-specific needs. Nurse practitioner scope varies between states, as some states do not allow them to work to the full extent of their training. I'm going to explain the NP's scope of practice by Nebraska state laws, which allows independent practice and full authority to NPs. Full practice authority allows nurse practitioners to manage patient conditions, prescribe them medications, order diagnostic tests and labs, create care plans for patients, and so many other things. Nurse practitioners can work in the family care clinics, hospitals, or at specialty clinics such as dermatology, urology, cardiology, etc. There are also specialty nurse practitioners that undergo a different type of continuing education, and they can become nurse anesthetists, nurse midwives, clinical nurse specialists, as well as others. NPs are not limited to any area of healthcare. The first school of nursing was developed in 1873, which was founded by the principles of nursing developed by Florence Nightingale. Her values and passion for nursing have led the profession and built it into what it is today. In 1996, the ANA developed the standards and scope of practices for APRNs. The foundation of nursing profession has always been professional, and it is the responsibility of those in the profession to educate others on the field and to uphold standards of the profession. Nurse practitioners have a unique role in healthcare. They have a strong desire to take care of others and advocate for their patients. Many patients state they feel more comfortable being seen by a nurse practitioner for primary care because they can spend more time with them than medical doctors. NPs can develop a strong patient-provider relationship and listen to the needs of their patient to develop a plan of care together. Nurse practitioners are also more cost-effective, which can lower patient and facility costs up to 33.3% depending on the purpose of the visit. In summary, nurse practitioners have the potential to greatly impact the healthcare community. They are able to build connections with their patients, aiding in reassurance and disease management. Using nurse practitioners saves the patient and facilities money and increases patient satisfaction rates. Nurses know how to educate their patients in a way that the patients can understand. This will help with disease progression and prevention. Nurses encourage patients to take control of their own health by promoting health and illness prevention.